Assalamu alaikum. I am Azza Abdussalam, BLS, ACLS, Pulse and NRB instructor. Today we are going to talk about the systematic approach. What is the meaning of systematic approach? We are using for advanced cardiac life support. It is organized method for handling the problem and intervention of identify the problem and the intervention. You have to evaluate your patient if your patient is coming conscious or unconscious. If he is conscious, so you are going by ACLS survey, initial assessment, primary assessment, and secondary assessment. But if your patient is unconscious, at this time you have to go with BLS assessment. You have to check the responsiveness. If no response, no pulse, no breathing, activate emergency response system 997. And you have to start. You have to start immediately. You have to start compression. Okay? You have to determine the landmark and you have to start 30 compression and 2 breath. You have to open the airway, head tilt chin left, and or jaw thrust according to the situation, and you have to start your compression. Okay, initial assessment for the patient. This is the doorway observation. Once you will see the patient, this is initial assessment. It takes a few seconds. If your patient is unconscious, so you will go with BLS assessment. Check responsiveness, check pulse and breathing. Okay, but if your patient is conscious, so you have to go with ACLS assessment. You will proceed to the primary assessment and secondary assessment. So initial assessment or rapid assessment, this one taking few seconds, and component of A, B, C. A for appearance, how he is sitting, how he is interacting. Okay, what is the level of consciousness? This one taking few seconds, you can assess your patient. B for breathing, he is taking breathing, there is difficulty of breathing, increased work of breathing, there is retraction, intercostal retraction. Okay, there is audible sound, without using stethoscope. And C, in the initial assessment, we used to say it's color. What is the color of the patient? He is pale, he is cyanotic. So initial assessment, what you can see, what you can hear, without touching the patient, taking few seconds, and this is to identify the problem. So you will identify the problem. This patient, if he cannot take breathing, he is sitting, he looks like sitting at the end of the chair, last of the chair, so he cannot take breathing. So this patient, we can say the patient need immediate intervention. Okay, what's your intervention? My intervention in the initial assessment, you have to call the team. Hey, you have to call your team in the ER. I am not working alone, so I am calling the team. They will come and will start assign the responsibility. One for opening the airway, for clearance and maintaining the airway and checking oxygenation, and one will apply the cardiac monitor and baby cuff and pulse oximeter, and the other one will open the airway, open the IV. She will open and she will put IV cannula. So you have to choose for the emergency cases one clever for inserting the cannula. I'm not blaming the new staff or I'm telling they are not good. No, my opinion that one old staff, good experience, she's inserting cannula quickly, she's the one will assign her for inserting cannula according to the staff in your team. But if your team all new, okay, you have to choose one of the clever for inserting cannula quickly. Okay, we'll proceed to the primary assessment. You stabilize the patient with the initial assessment, that you open the airway, clear the airway, and maintain the airway. If you cannot maintain by normal maintaining, you have to use airway adjuncts, oropharyngeal and nasopharyngeal. Okay, you have to open the airway by head tilt chin left and using the airway adjuncts. Then you will proceed to primary assessment. You will start to use A, B, C, D, E for the primary assessment. A for airway. be sure يعني be sure that the airway is open, maintained and clear. If needs suctioning, if there is foreign body, you have to remove. Okay, then you have to go for breathing. Breathing, you have to check the patient taking normal breathing or he cannot take breathing. There is any audible sound like stride or wheezing. You can use the stethoscope to check if there is any sound, and you have to check the bilateral air entry. Sometimes it is tension pneumothorax, so if you are checking one side, you have to check the other side by stethoscope. Okay, check the by pulsoximeter oxygen saturation. Suppose it is the minimal is 94, so if it is 90 or 88, so we have to start to put oxygen. Okay, we'll go for C. C, you are applying the cardiac monitor, so you have to check the pulse. Maybe he has tachycardia or bradycardia, okay, or cardiac arrest, so you have to check by the monitor the pulse. Blood pressure, you have to check it is hypotension or hypertension, whatever. Okay, then you have to check the central pulse and peripheral pulse, because weak or absence of the central and peripheral pulse, maybe it is a signs of early signs of shock. Then you have to check the capillary refill. Capillary refill, you know, it's very important, because if there is low cardiac output and the capillary refill more than 2 seconds, for example, prolonged capillary refill 4 seconds or 5 seconds, and also there is tachycardia, hypotension, all of this, the signs of shock. So immediately you have to start for fluids replacement for the shock. Okay, and you have to decide what is the type of shock. You have to ask the family. Ask the family, this is RTA, too much bleeding, fluid loss. So you can decide what is the type of shock, and you have to make fluid replacement. Okay, then you will go with the disability. Disability, they are talking about disability, or they are telling there is a mnemonic AVPO, AVPU, A for alert. So you have to check the neurological status, the consciousness of the patient by AVPO. If you are telling the patient, good morning, Abdullah, then Abdullah answering you, good morning, so he is alert. Okay, so no need to go with a V, response to voice, and P, response to pain, okay, or you unresponsive, already he answer you. So AVPO, to use the consciousness of the patient. A for alert, V response to voice, P response to pain, and U unresponsive. Okay, and you have to check the blood glucose. Why I will check the blood glucose? Because hypoglycemia will affect the patient. Maybe he will loss of consciousness, and some signs it will come related to hypoglycemia. So to as an emergency and to avoid this one hypoglycemia, you have to check blood glucose. Be sure it is not hypoglycemia. Okay, then you will go for exposure. Exposure, from the word of exposure, you have to expose the patient. You have to check in the chest, extremities, back. You have to check any signs of bleeding, any signs of burn. Okay, what is the color of the skin, mottled skin, or purpura, petechia. So any signs it will appear for the skin. This is the primary assessment. Okay, if your patient became more stabilized, so you have to proceed to the secondary assessment. Secondary assessment, it will be focused history. You have to take the focused history. We are using mnemonic sample, SAMPLE. Okay, and you have to do focused physical examination, you have to do neurological assessment, and you have to do diagnostic test. Okay, this one for gathering information, for more details about the patient, and you have to identify what is the diagnosis it will be for the patient. What is the diagnosis? You have to identify the problem by putting the diagnosis, and you have to make a plan for intervention. So we are proceeding to the secondary assessment. Secondary assessment, you are gathering data and you are making reassessment for the patient. We are using the mnemonic is sample. S for sign and symptom, A for allergy, M for medications, and P for past medical history. You are asking the patient, and last meal consumed or last intake and output. Okay, and events lead the patient to the sign and symptom. So you have to reassess the patient to gathering information and to make differential diagnosis, so you can decide and identify what is diagnosis for the